Yeah, thank you so much. So without going back into introducing myself, I'll be speaking on gender-based and domestic violence among persons with disabilities. And I would be focusing on causes and sustainable preventive strategies in these areas. So basically, I would like to first of all delve into domestic violence. It refers to any form of physical, emotional, psychological, sexual abuse, as well as economic coercion exerted by any person against another within a domestic setting. This also often involves, patterns of control or coercive behaviors that is aimed at gaining a form of or maintaining control over a family member or partner. Whereas gender-based violence encompasses a little more to mean, encompasses more of harmful acts directed against an individual based on their gender or sexual orientation. And my interaction today will focus more on the factors that increase susceptibility to domestic violence and gender-based violence, which in this case, of course, in this balance, specifically disability and preventive strategies. So normally domestic violence and gender-based violence disproportionately affects women and girls, and this is rooted in systemic gender inequalities and unequal power relations. We all know our society to be quite, gender biased. The disability now including disability, now exacerbates the prevalence of domestic violence against women and girls with disability. Being a woman already makes you susceptible based on the definitions we've seen, depending on power play and, the inequities. Now, having disability then makes it worse. So it's worse for women and girls with disability. So let's look at some of the factors that make them susceptible. For instance, my number one is dependence. Because everything is rooted in dependence, or often rooted in dependence. Sometimes they are dependent on these caregivers, the people who take care of them, who may then be the ones exerting these unhealthy patterns of control, because they know that the person depends solely on them for major activities in their lives, like mobility or even living self. It further makes them vulnerable. And these persons, they first think of, the uncertainty of what will happen. If I report this person now, who will take care of me? Will they even believe me? Do I have the means, the wherewithal to pursue this matter? And, after examining these uncertainties, they'd rather just not say a thing. They don't know what lies ahead. So they just often give up and not bother. Now let's look at social isolation. Now, a person who naturally depends on someone, if you don't have money and you depend on someone to maybe transport yourself somewhere or go to places, there's a tendency for you to have some level of inferiority complex. Now, besides the money. Now, persons with disability, oftentimes, especially if they are not giving the normally raising children, if you see a person that is raised to be timid, you will know by they are clogged with a lot of insecurities, a lot of inferiority complexes and all of those. Now, someone that has disability already feels some type of way most of the time, not all of them, but most of the time. And then those who are born with their disabilities, especially in some situations, which is often the case, are raised to feel less of themselves. So that insecurity is already there. And then they are dependent on someone. Now that one is already an insecurity of its own. Now there is a high percentage of chance for that person to be socially isolated. So when they are socially isolated, it also compounds the issue. A person who is socially isolated, how will they even have the information that would lead to reporting such a case or even identifying abuse? So that's a cause. That's a major cause. Now, stigmatization and discrimination. Due to, prevalent exclusion practices that is innate in our society, our cultures, the African culture generally, or our system, we have lots of societal prejudices that is negative stereotypes, which make persons with disability more vulnerable, to violence, abuse. Example, there's this belief that in some parts of Africa, I don't know if that is obtainable here in Nigeria. I've not heard that has happened in Nigeria, but I know, and I have friends who are really fighting this in their country, where they believe that persons living with albinism are good for money rituals. That's abominable to me. That should not even be a thought that should come up. But of course, it exists, and other such preposterous beliefs. I'm sure in our societies we can think up of something like that. These are stigmatizations, and these are things that can contribute to stigma, contribute to discrimination. Like vitiligo. Some people think that is contagious. Also stemming from ignorance and all of that. And then now lack of awareness and education. This could be viewed, in my own opinion, let's look at it from two different perspectives now. This perspective of general disability inclusion awareness, and then the one of education. Both PWDs and their communities may lack awareness about the rights of persons with disability and or channels through which they can access justice or specific kinds of help. This makes it harder now, for them to even recognize abuse. Least of all, report it. Is it not what is happening that you'll be able to report? On the other hand, access to education is both limited and expensive for persons with disability. Most government schools, in my experience, most government schools are not equipped to accommodate learners who are different or who have special needs. Not even the structures. You go to government schools that have upstairs and you don't see ramps. Please tell me, how can a child who is immobile be able to access those schools? Their immobility is not affecting their brain to learn. And then where they don't have trained educators, how will persons with disabilities be able to access it? Now, this leaves access only to those that can afford it. These high-cost private schools with the right structural and system accommodation and assistive technology for disability inclusion. I don't know if how many of those schools, maybe places like Lagos and Abuja, I don't know if you might find government schools that are dedicated to inclusion or even special schools, and they are good. And they have the technology. It is not on paper, because that our governments, they like using us for props sometimes, and they would name a school inclusive. But when you go to the school and visit their library, you don't see any braille books, you don't see any recorders, you don't see anything at all that makes it inclusive. It's just on paper. So, but that's mostly what you see. Or when you even see, the truth is that it is expensive to run an inclusive school because of assistive technology and because of how our economy, in fact, it's because of our economy, because it's not so in most other developed countries. So now let's look at inaccessible support services. This one like this it makes me this impacts every sector, and I think everyone can relate to this. The fact that support is something that is very unavailable. Support services such as shelters, counseling, which are both very key, very important to for survivors or victims to primarily escape their abusers and for their rehabilitation as well. These are often not easily accessible to the average Nigerian normally. You would not readily just see a walk-in center where you can go and access mental health counseling or where you can find a shrink. These are things these are things available to the rich, where they will tell you that, in fact, for the average Nigerian, at least you can afford 10,000 naira per session. How many persons with disabilities, how many survivors of gender-based violence generally can afford that? Because gender-based violence often starts with things that might seem like little things. It's not all the time. It starts with beating or outright violence, So for these people to be able to assess it, it's expensive. And for the average Nigerian, it's generally not acceptable and not accessible. And based on my experience, more than 50% of persons with disability are below average income earners or mostly dependents. Thus, these services are not accessible to them, limiting their ability to seek or get help. Now, let's look at economic dependence. The government secondary schools are hardly structured to accommodate persons with disabilities, ranging from trained special educators, instructional tools, and physical structures even, like I had mentioned earlier. This impacts on the number of persons with disability who even make it out of secondary school, who even make it through secondary school, least of all talking about making it to tertiary schools, which are often expensive, the very few ones available. How many of them can afford it? That at least these tertiary institutions will have to have required accommodation and technology for specialized or inclusive learning. And then this then further impacts on the number that are able to qualify for employment. The few who qualify for employment are often frustrated out of those employments because their employers do not make accommodation available for them to be able to work. And then they will now call them out and tag them unqualified, or say that they are playing victims, or they are seeking, they are not capable of doing their jobs, which is not true most of the time. These factors force them back to dependence, financial dependence, which then traps them in violent situations as they may lack the resources, not even may, they often lack the resources to escape. Now let's look at my number 8, communication barriers. Through my work, I have toured a good number of communities where I work and visited the very limited existing government schools, private schools, which are often low-cost, low-income private schools in these communities that you will find where one person, maybe a school SAT holder, WAEC holder, or even someone who is, maybe they are looking for money. They are students in that school, but they are looking for money to pay for their WAEC or register for WAEC. And then because they have good relationship with the school will then employ them as teachers so that they earn enough to come back and register and write WAEC. And then you find these people who are not qualified to even teach their own class, taking like maybe up to 3 subjects for senior secondary schools because it's low-cost school. Those are the kinds of people that those schools can afford to pay, in these communities. And each time you find I remember an incident where we, not just one, so many times that we've gone to these schools and then we find deaf learners and they are simply just sitting and staring amidst class activities that they don't understand. The teachers are not trained to help them. The teachers cannot communicate or understand them. And then the teachers will tell us there that they are privileged to be allowed out with their mates. And some of the parents would then respond, their own response is often, they believe that it is better for them to just go out with their mates, let them not stay inside the house. And these are a few parents, and when they tell you they are privileged, they often are, because these communities are communities that believe that that disability is a curse, and then this then further impresses on the families of persons with disability to hide their children. So if they don't hide you, it's a privilege. So that's why these teachers say it's a privilege for them to even come out. So at the end of the day, this learning has not happened for them. They still don't have a way of communicating. Nothing has happened for them. Now, these are often communities, like I said, these communities themselves are already looking at disability as a curse. So what help do they have to render to those people? And then someone told us that, I asked, so how do you communicate with this person at home? And they say, if they want to eat food now, they will point to the pot. So communication begins and ends with pointing to pot for them. These persons with communication impairments find it really challenging. Tell me, how will they report abuse? How? By the time most times it is people who are supposed to help them. Those people who are supposed to take care of them that often abuse them. I've mentioned, amidst all of this, I've mentioned a couple of cultural and societal norms that devalue persons with disability, which further contributes to the high rates of abuse and, discrimination and violence meted to persons with disabilities. Now, let's quickly run through the sustainable preventive strategies that I've outlined, based off on what we've talked about, the causes mentioned already. And let's look at education and awareness campaigns. Now, I'm talking about things that I think that if done, we will be able to mitigate these challenges. Within our organization in Kachem Young Initiative, we strategically structured our literacy center to be inclusive. Our centers provide sign language interpretations for mentees or the community members who use them. It houses inclusive libraries as well and implements inclusive academic tutoring. Sometimes we also, because of assistive technology, we use improvised methods, improvised slates as braille books. Then we provide counseling, affordable counseling, and refer victims of GBV who visit the center, those who are able to make it, because while we are there in the community, it's a partnership between us and the community. So we work with the locals to be able to, elicit information and then help those people be able to trust us enough to open up about abuse cases and report them. Then we connect them to legal services and affordable counseling. Or, the stakeholders, the right stakeholders, government stakeholders, which most of the times don't do anything, and then we end up taking up the matter legally and all by ourselves. In each host community, our disability inclusion desk also implements what we call legal competency training and advocacy for their leaders, the leaders of the community, to make aware, to ensure that they are aware of available laws and ensure their customs and cultures is now left for them. After we've made you aware of the available laws, you will not then claim to be ignorant of your cultural beliefs and if they are repugnant to these laws. Because sometimes it is ignorance that perpetuates these laws. So we want to rule out the possibility of ignorance so that when we catch you or when the law catches you, you will know that you have no excuse actually. We also have our annual Brave Voices conference, which is designed to bridge inclusion gaps in advocacy, targeting PWDs and their caregivers, political, education, community leaderships, law enforcement and advocates, generally stakeholders in different sectors, in commemoration of the UN 16 Days of Activism. We do that annually. And these types of comprehensive educational programs raises awareness about the rights of persons with disability and the unacceptability of abuse, as well as shedding light on locking issues, because some people may not know some of these causes or the strategies that can be used. Then it will then look as if government is not doing anything. But if they are made aware and then, creating the right kind of structure or the ground for the help to come, perhaps they will do something. Then accessibility, accessible support services, ensuring that all support services, including shelters, hotlines, and counseling centers, as I had mentioned earlier, are fully accessible to persons with disability using, for example, structures such as MDAs, primary health centers, and working with civil societies, creating the right cohesion, because civil societies often have have better grassroots strategies. At least more often than not, they do. These include like physical accessibility to structures, assessing these places, and the availability of assistive technologies, which is often expensive for individuals, especially persons with disability. And we know governments will be able to afford these things, to put them in their centers for these people to access. Every community has primary health center, at least. And I don't know about other states, but I know in Ebonyi State, we have what we call gender-based violence task force. It's called task force, not for them to go and stay in one office with AC and wait for these persons to approach them. What if they don't know how? It's called task force, and task force, what they do is move around. They should have outlets in these communities and go around creating awareness of their existence so that people can know them and then assess them. Empowerment programs. Oftentimes, when they say they are doing empowerment programs, especially government, they say they are doing empowerment programs for persons with disability. They go through JONAPID, the Joint Association of Persons with Disabilities in Nigeria. And some JONAPIDs, this is not to say that some JONAPIDs chapters are not working well. They often are. But most of the time, you find that the meaning of empowerment for them is that they shared wrapper, they shared rice, they shared, those frivolous, passive things that would not go beyond 1 year and it has finished. I'm even saying 1 year self. After you made the clothes, how has it helped you? How has it improved on your trajectory? How has it changed your trajectory or changed the course of your life? Whereas they can empower persons with disability with skills, scholarship programs. Yes, because the fact that I'm not able to afford an expensive school doesn't mean that I will not be able to be sustained, or my brain is not able to sustain me in those schools and pass exam like others. It just simply means I don't have the means to. If government is able to provide me with the means to, then I would be able to access a level playground with other people, with my counterparts. These are the kinds of things that would build their self-esteem, create independence and financial literacy for persons with disability, and this can reduce dependence and potential abuse, reducing susceptibility to abuse. Training for caregivers and service providers. Now, let's take note that sometimes caregivers are not all bad. Sometimes it's just simple frustration, and it can be frustrating to take care of persons with some kinds of disability. But training would help them understand how to provide specialized care. Training for law enforcement, service providers on how to recognize and respond to signs of abuse, one, but also how to respond, how to understand the kind of, you can't just bring someone whose training is only sign language and then you put them because, maybe because it's a job and they need the job and you know them. Then you put them to care for people living with autism or Down syndrome. They might lash out on them. And that abuse, that you're lashing out of ignorance, doesn't make it less of abuse. So these trainings for caregivers, service providers, law enforcement advocates, these trainings and awareness creation amongst them would help to mitigate that as a factor for abuse. Then taking legislative measures. Advocate for and implement laws. And the truth is, Nigeria, for instance, and some other African countries, we have a lot of laws. We're very good with assenting to laws, to bills, making it an act. In 1 year, if you go to see how many laws have been put in place, policies here and there, bills, advocates, millions of advocates out there, how many of those laws are implemented? How many of those laws are used? How many of them are explored even? How many people are aware that these laws even exist? So it still boils down to creating awareness on existing legislations, and looking at those legislations to be sure that they are inclusive, because you cannot say that you made laws for a country where the country, are you excluding persons with disability? Are they not part of the country that I have disability? Does it make me any less of a less Nigerian? Does it make you more Nigerian than me that you're able? It doesn't. So it means that the law ought to protect all its citizens, including persons with disabilities. So legislations should be, we should ensure that legislations are inclusive. Support networks. And when we create peer mentoring, support groups, and, provide specialized support for persons with disability, the budget should capture it. Ensuring that they are captured by budget makes it innate. It makes us own it. It makes the country own it. It makes us aware that we are not doing props, that this one is real business. Because these are things that determine whether some of your citizens stay alive or well, heavily impact on the lives of your citizens. So to foster the development of support networks for PWDs, that's persons with disabilities, including peer support groups and community organizations, to reduce social isolation, like I had mentioned earlier, and provide safe spaces for sharing experiences. These would help. That's why in our Brave Voices, we have storytelling. When the persons with disability share their experiences and share their stories, it humanizes the issue and makes people see that it is humans going through this. It creates, it elicits the right kind of empathy, and then action as well. And technology and innovation, we cannot overemphasize it. The sole reason for dependence is inaccessibility to assistive technology. There are so many assistive technology that help persons with disability to live independent of any form of help. They live on their own, by themselves, in smart homes, sometimes just relatively smart home, sometimes not smart home at all, but they have the right kind of, the basic assistive technology to move around, to get by, to do the things that other people normally do. Each state, we have state libraries, and then you go to a state library, there is no ramp. You want to buy these are accessibilities, structures in accessibilities, technology, innovations, and all of those to create the right accessibilities in the community that we all live in, which is also the community that persons with disabilities live in, And then you go to a pharmacy to buy something and you see how they raise their structures, that even you that do not have any form of disability, you need to exert so much strength to climb it. So the person with disability that wants to purchase medication should also, in this pharmacy, I'm using pharmacy because these are basic needs. These are the unavoidable places that you have to go to. And then you have to wait outside. So you have to stand outside by the main road, depending on where you live. You stand there to wait for them to come out and see you, which oftentimes, being a person with disability, the societal prejudices has impacted on the biases of people, and then they act discriminatorily to people with disabilities. So we need to utilize technology such as apps as well, and online platforms to provide PWDs with resources, support, and reporting mechanisms. Especially for Ministry of Women Affairs, they wait for people to approach. They did not report now. What about those who are unable to? How have you made available means for them to actually be able to access the resources to report? So government owes its citizens a duty of care to do that. But not just government. See me mentioning government. Even organizations. One of the things that I always encourage every organization, whether or not you're dealing in disability inclusion, is ask yourself, how are your services inclusive? If you say you're catering to women and girls issues, remember that disability does not make that person any less of a woman or girl. So it should encompass the people that, fit into the target audience that you meet, that you provide services to, which include persons with disability as well. Now, inclusive policy making, I think I've talked about that. Public-private partnership. Now, public, I would say public, private, government cohesion. So creating a cross-sectoral cohesion within the government, public, private, and, civil sector. This will encourage the right kind of collaboration. So whereas government they have the access and most times the resources, individuals, that's the private sector, whether it's individuals or corporate bodies through their corporate social responsibilities, can provide the resources as well. And then the public sector, which also encompasses the government people and all of that. And then the civic sector would then come together, everyone bringing their arsenals to work together to ensure inclusivity across these sectors. So while our centers model inclusion, imagine if the government were more willing to partner with us to be able to provide these services in the government schools. All it will take them is provide the access and the right environment for their staff, for the teachers to be trained. But they leave, once they hear NGO, they raise their hands high. They think that you bring all the dollars and then they remove themselves. Whereas one thing with partnership is it's not just about the resources, it's about the fact that it gives you a seat. It gives all partners sense of belonging and ownership to that project, so that now births sustainability initiatives. So everyone is part of the sustainability plan. That way, the solution is sustained. By addressing these root causes and, implementing comprehensively the strategies, inclusive strategies, society can work towards significantly reducing gender-based violence and, domestic violence among persons with disabilities. And there is a lot of clamor, against let's eliminate GBV, but that we advocate to eliminate GBV is not enough when it comes for persons with disability. You need to tailor advocacy to their situation, because their situation is peculiar depending on the disability. So a lot has been said, a lot is often said, a lot will still be said about disability inclusion board. And if some of these strategies that I've mentioned and some of the causes that are just to mention but a few, there are so many. And one of the things that I would like to also mention is data research. Research is extremely important, because sometimes research that is done on disability inclusion, the data collected is often not from people with disabilities themselves. So I would say that those data are often wrong. Maybe not all of them, but most of them are wrong, because you cannot act. Most of them are merged with ableism. They will go and ask. Someone will want to do research, but they do not want the stress that comes with it. So they go to the urban areas, they go to the areas, they book appointments with people with disability who have rights. I'm sorry, their situation is not the same as the average person with disability who probably resides in a community. And I'm able to know some of the things I know, not by studying them in school. I'm able to know them by being on the ground, in the field, and doing the work. And sometimes we think we know until we get to another community, and then they blow our mind with one preposterous practice, and then we know again all over again that we don't know again. So there's a lot of research that needs to be done. These researches would then inform the growing strategies. It would inform, the solutions innovated, new innovations, technologies. It would inform them so that these challenges and issues will be mitigated and all. At this point, I think I would let it rest if we have questions. And again, thank you guys for inviting me for this. This is a passion of mine. And if you let me talk, I could talk from now till thy kingdom come on disability inclusion and all. Thank you so much, everyone. Thank you for having me.
Okay, so my question basically is about um the fact that I feel like they are, I think most of them are, I don't know if I'm correct, I think they are grouped as risk factors, right? Basically, some of the main problem or some of those factors that allow people with disabilities to be in a situation whereby they can go as far as being sexually abused or sexually harassed. And I've been thinking about it since you have been mentioning a lot of things. I've been writing them down, and I'm asking myself a question: that is there a way that in our advocacy we can include some of these risk factors like poverty, and how can we even address it, knowing fully well that people with disabilities require special needs? They require their the response that we have to give to them is not like the general one where you say, okay, create more opportunities, okay, increase wages and the like. So I really don't know if you have something to say to that aspect.
Okay, so to answer that, you know that there are several kinds of disabilities, right? Now, disability does not mean that a person is not, disability just means differently able. And we owe it to ourselves as a society to create the opportunities for our survival, or to create the enabling environment for our survival. So creating this enabling environment selectively is not acceptable. So for example, in a workplace, an office that is upstairs, no ramp, and then you employ someone using wheelchair. That person is an expert in their field, but they can't climb. They cannot climb the upstairs. Now that employer owes a duty of care to that person they have employed to create an enabling environment for them to do their job. It's in the labor law, the Labor Act, Now, let's go to, say, persons living with autism spectrum. You know that not all persons living with autism are uneducable. In fact, there is nobody living with autism that is uneducable. It is now left for us to find, starting with the family unit, down to the community where the person lives, and down to the school where the person attends, which of course government owes that person a duty of care to also provide the enabling environment for them to learn. Now, a person living with autism, maybe just like every other person, there are people who do not want to go to school, but they are good at business. And then there is another person who just wants to learn a skill. And there are several skills that they want to learn, maybe sewing. In fact, one of the people who makes my shoes has autism. Now, if an organization wants to create an intervention, they first of all do needs assessment. It is during needs assessment that you now assess these people with disability, what kinds of skills, what are their areas of strength. Identifying their areas of strength will then help you create the kind of programs that can empower them based off on those areas of strength. So that's what I think that organizations should do. And then when it comes to government, I think that every government school, if not every government school, then create specialized schools where these persons with disabilities, depending on their disability, can thrive or have equal education. It's called education equity, where they can equally access what you have made available to their counterparts simply because they are able. I don't know if that makes sense, if that answers your question and all, but there is always a point of strength. Let's see it this way. You like rice, I like beans. Simple and short. They should give you rice, they should give me beans. They should not force me to eat rice because you like rice. I don't know if I'm trying to simplify it to make it as simple as possible. Okay, so you walk. I have something that enables me walk. Then taking that into cognizance, an employer or a government building should be made to accommodate both you and me for employment. And then governments have, I don't know about, but I know that most states, they have like entrepreneurial centers where people go to, skill centers, basically where people go to learn skills. From time to time, they run empowerment programs where they accommodate people to run skills. But when it's now time to empower, those during a selection of people who would be engaged in those skills, selection process should be inclusive. Government should provide sign language interpreters for persons with disability to also learn those skills and communicate properly while learning those skills. A friend of mine runs a program where she trains caregivers and trains persons with disabilities in robotics. And they learn, people living with Down syndrome. Down syndrome is an intellectual disability, and they learn. And they go to school and they learn. I know you guys know of the country that I'm trying to not make a mistake now, but they have a congresswoman or a legislature who is living with Down syndrome. And she's an advocate, strong advocate, So I think that when the society reorientates itself on disability inclusion and understands disability from the angle of differently able, you are able in this, I am able in the other, then it makes it easy for us to include persons with disability.